it absolutely does no good on the shelf. So I find, and this is something I've really enjoyed doing, is working with patients. Give them as much knowledge as they need so they know why we're talking about doing something, why I'm suggesting a medication. They're in control. Because when it really gets down to it, whatever I suggest, it's a recommendation. It's up to the individual, which gives them the responsibility. Maybe gets me off the hook, but gives them the responsibility for their own care, which really is the most important thing, I think.
Yeah. So people don't see it as the doctor is the high almighty physician as in the past, and what he said goes. Is
Yeah,
there
I
just
think
too many specialty groups and too much to know out there in the medical?
Yeah, I don't know if so much that as much as patients now are much more less, you may be the expert in something, but they want to know why. And I think that empowerment has made a big difference for us, because it allows us to, put some of that, when something's a failure, it's a failure because we haven't informed the patient enough. We haven't, really pushed how much to do it if something doesn't work, if it's not being done.
Yeah, and what to do. You mentioned hypertension is a big problem anymore, and we're going to talk about hypertension and diabetes, which we seem to see in the news all the time, and our obesity plays a factor in both of those. Is that not right?
Indeed, it's a there's a thing we call it's a syndrome. It's what they call a metabolic syndrome in some circumstances, which I'm not sure exactly what that means. The people that coined it, and they're backing off a little bit, but it's all
that
those
a
things
protected
together.
Class?
Yeah, it might be. But it's with obesity, with weight, it puts more strain on the heart and leads to the hypertension. It puts more strain on the pancreas, leads to diabetes, the most common type being type 2, which is definitely weight-related, I should say. And a lot of times by working on weight, exercise, it's a possibility to even prevent the disease or even treat it. Have had some successes, which is when the patients sit there and it's to the point of you're on this medication and you now need to take for your diabetes a shot, and it's like, no, I don't want any shots. There's one gentleman I can remember to this day. It was just because he took over. He said, I don't want any shots. I said, well, then you got to lose, 30 pounds at least, to do it, because he was weighing at 360. And he went on his own, and 3 months later, he'd gone from 3 pills twice a day, 3 different medications twice a day, down to 1 pill twice a day, and his diabetes was under control, and he didn't have to take the shots. And he's one of those guys I use as an example of it can be done. It wasn't easy, and I give him all the credit because he had to do it.
Well, that's good to hear, because we think of the American male as putting off seeing a physician.
Oh.
And, the macho guys not going to a physician for anything, as a matter of fact, yeah, unless the bone's sticking out of your arm.
Yeah.
Or something. We're talking hypertension, which in lay terms we think of as high blood pressure. What are conditions and symptoms of high blood pressure?
High blood pressure has been known for a long time as the silent killer. And that's because you don't know many times that you have it if you don't look for it until you have the symptoms. And the symptoms is a stroke. The symptoms is a heart attack. The symptoms is kidney failure and dialysis. And so we really want to treat it before you've got to the point where you actually know that you have it. And that makes it difficult because we're treating something that doesn't bother you. And so the patient comes in and we say, you've got hypertension. I feel fine. Why do you want me to take this pill? And we have to then go into work preventing problems. And then the definition, what is hypertension? Patients ask, is that because I'm tense? Am I hyper? And it simply is that elevated blood pressure. And it's the combination, there's 2 types to it. There's always 2 numbers that we use. The higher number, like 140 over 90, use that as an example. And people go, it's at 90 over 140, 140 over 90. But what it is, it's the pressure that the heart, when it pumps, it sends a pulse, just like the water when you turn on the tap into the hose. And when it gets to the end of the hose, if you've got it turned off, that pressure builds up. Well, when you open it up, the maximum pressure in the hose is the same thing that we're using called the systolic pressure. That's that 140, the upper of the 2 numbers. And the diastolic pressure, the lower of the 2 numbers, is the pressure that's always there, that it has to pump against before the valves open up and the blood moves forward. So those are the 2 numbers. And then what is hypertension is It's a number. It's I call them magic numbers, but it's something that we've looked at. We know that if it's above these numbers, you have greater incidence of problems.
Yeah.
And that's the infamous 140/90. 130 over 80 is good, below there. 130 over 80 up to the 140 over 90 is considered borderline. And we yell at people and say, oh, lose weight, exercise, get mellow, whatever it is. Watch the salt if you are a person that's sensitive to salt. Lifestyle. And then between 140 over 90 to, as you go up, is elevated blood pressure. And if we can't get it down, then we treat it with medications.
Excuse me, does blood pressure, is that dependent on weight?
Not at all.
Okay.
Some people can be very thin and still have elevated blood pressure. Now, we do know, though, the heavier you are, the greater the risk of hypertension. Again, African Americans have a higher risk for hypertension. But again, the main factor that we see in this country is weight.
Yep. Now, we live in such stressful times, whether it be at work, even at home. How does a person know, without coming to you to get their blood pressure checked, that they do or that they might have hypertension?
Well, doing a screening is not a bad thing, and they're all over the place. I mean, you go into any...
Go to CVS and get your blood pressure
and you can do it while you're waiting. I usually recommend doing it before you get the bill, but because, like you said, stress, things can make it go up.
Yes.
But while you're sitting, and you want to sit for a few minutes, because you don't want to just come running in. You had a hard time parking, you're running late, you're trying to do something. Sit down for a couple minutes while you're waiting, put the arm in the cuff, and then measure it. And it'll give you a reading. And if it's above the 130 over 80, you need to pay attention to it. 140 over 90, you need to get it checked. And then that's what we do. We don't diagnose this. Just one time doesn't mean you have hypertension.
Right.
You really want to check it a couple of times. And the same thing, a physician would check it a couple of times, unless it comes in at, let's say you walked in the office and it was 180 over 120, I would get excited because, again, it's the higher for the longer period of time, the greater the risk. And that's way too high.
But as you mentioned about the bill at the pharmacy, doesn't coming to see you cause that same stress?
Well, we call it white coat hypertension. I'm wearing the white coat, so in my office I wear a gray coat most of the time. Doesn't help. It's the stress, and so that's why we, if it's elevated, we will recheck it after a little bit of time. A lot of different factors do it. Having a cup of coffee within a half hour can raise the pressure a little bit. Smoking a cigarette will raise the blood pressure. Again, the rushing coming in. Nurses are much nicer, less stressful. Pressures are usually lower than when the doctor does it. They've actually done a study, and doctors run about 5 points higher than do nurses doing the same blood pressure, because they know we're the ones that order the bad things, like the shots. I would think it would be the nurses because they give the shots, but again, it's I haven't studied for this exam type of stress, I think, that does it.
Yeah. And what do you advise for those patients with high blood pressure, other than lose some weight, maybe?
Well, a big thing is lifestyle. For most things. I mean, it's amazing how much of medicine is lifestyle, and it's so difficult in this. We don't have time, and trying to fit those times in. Losing weight is easy for me to say. The more you have to lose it, the harder it is to lose. It's just because that's the way the body is. The more you weigh, it's not an excuse to say you can't do that, but it does take much more effort for somebody who has the genes, if you will, for higher weight to keep that weight down, and it's an effort. So that's the first thing we like to do, is stress those type of things. If you're smoking, stop. If you're overweight, work on getting it down. And again, 10 pounds can make a big difference. It's amazing. 10, 20 pounds. We're not talking getting back to what you were in 10th grade, but unless, of course, you were a football player in the center, in which case you're pretty heavy.
Yeah, big guys.
Big guys. And again, it depends on the individual.
Yeah. Speaking of weight, we were also talking about diabetes being a problem with obesity here in at least in America anymore. What is diabetes? You talked about type 2 being the most common, and what are the causes for diabetes?
That's one of those words that we use, the type 2. What does that mean? There's two main types of diabetes. And diabetes itself, which is short for diabetes mellitus, it's some sort of Greek word, but it means essentially sugary urine. It comes from one of two things, but essentially not enough insulin. The pancreas, which is one of the organs in the body, those who are into it, it's called the sweetbreads, but it's down in the abdomen, and what it does, it produces